Hello and good evening to you all. It's 8 p.m. UK time, so it's time for our IVF webinar tonight. I would like to welcome back our expert tonight. This is Dr. Malini Uppal, and this is her second webinar with us. So glad to have you back here. And how are you today? How are you feeling?
I'm good, Caroline. Hello there. Good evening. It is lovely to be back, and I really, really like this platform where I can actually give some message and pass on some information to our patients around the world. So, thank you for having me back.
Thank you for joining us again, of course. And just let me remind everyone that all those events have been brought to you so that you can just find out, ask your questions, and learn a bit more on various topics on IVF or related things, simply because we know right now most of you are not able to go ahead with your treatment, start them or continue them. However, we know this will be possible quite soon, so all of us are keeping our fingers crossed for you all. And I just want to mention that our Stronger Together initiative has been brought to you also thanks to our ambassadors and partners, and you can see them right here. There's quite a bunch of people that have been helping us, and of course plus our experts. So without them it wouldn't be possible. So as always, I definitely want to thank them again for their support. And I have mentioned to you already that tonight we have with us Dr. Malini Uppal, and she is actually a fertility specialist at GENNET City Fertility, which is located in London, and she will talk today about egg freezing. So this is definitely an interesting topic and very important topic. So we will start with Dr. Malini presentation. Okay, it will take 25 minutes, and after that we will go for your questions. All you need to do is type them in the chat section, and Dr. Malini will simply help you out, I am sure. So go ahead and type them in. You can do it now or later on, and I'm sure she will be able to advise as well. And that is it from me at this point. Dr. Malini, are you ready to go ahead?
Yes. Hello, everyone, and greetings from London. I hope you're well and safe wherever you guys are. I'm going to start with the good news that our clinic has got the permission and license to start the treatment. So it is a good news for us, and it's good news for all our patients who've been waiting for the treatment. Today I'm talking about egg freezing. It is a topic very, very special to me, very, very close to my heart, because day in and day out in the profession, I see us women who are now wanting to do more in life, but then struggling later on with the idea of having children or starting a family, and it becomes difficult later on. So there is something that, as I said, it's very close to my heart. So some little things, some little tips, some little information that I want to give it to you, to make more and more women aware around the world, to know that we have got this wonderful invention right now, and we are lucky to have it, that we can freeze our eggs. So why should any woman consider egg freezing? So this is where I start from. Like, infertility is actually a significant health issue that affects almost 12% of the women of reproductive age. So, which is a large percentage of women if you think about it, and most often publicized. The infertility epidemic that we're saying so many people are going through fertility treatment these days has now been attributed to the phenomenon of delayed childbearing, and which is what we have the right to do that, but that's what this epidemic or infertility epidemic has been, claimed as to be. So, who are the people, who are the women who should consider egg freezing? You could, so egg freezing is broadly categorized into two categories. It could be for any medical reasons, and it could be for social reasons. So if you could be somebody who's been diagnosed with any medical condition that needs treatment, and that can, with treatment that can affect your fertility status. So you should definitely consider egg freezing before you go ahead with such treatments. You have a family history of early menopause. There are families, there are women whose mothers, whose sisters, or other aunts or people in the family who've had early menopause, and it is there in the family. Then you are somebody who should definitely consider doing egg freezing. You are worried about your declining fertility and want to have children in future, but you are not ready at the moment. You are doing something else. You are studying. You are, you want to pursue other things in your life at the moment, and but you do still want to have children. So that's a very good option for you. Um, Women who are working in armed forces, police, and where you can have a risk, there is a risk of having some sort of injuries and sometimes even death. They are the ones who should be safe and have their eggs on the ice, and then at least when it comes time to use it, you have an option there. And now we also know that there could be people who are thinking about sex change, gender reassignment, and they would be using medication, drugs, which eventually they will lose their fertility or their gametes, and they should consider freezing before going through these changes. So I'm going to be touching the topics of why we should consider this. Um, we there is a known fact that there is a age related drop in women's fertility. So the older we get, our fertility decreases, not only in the number of eggs that we've got. So we are born with a finite number of eggs which we start using when we attain puberty, and we're using that every month. So by with the advancing age, this pot of eggs, or this um, egg reserve that we were born with, we are using it, so it decreases, and therefore the fertility decreases, or the chances of conception decreases. Once we attain mid 30s, once we are 35, there is a accelerated decline in the fertility. So it is quite stable in the early 20s, up to late 20s, coming up to 30. But once we hit 35 and we go below down there, there is a steep accelerated decline in our fertility status. We also have to know that there is a higher risk of miscarriage associated with increasing age. So that's another important thing that we have to understand, that yes, it's not that you cannot get pregnant after 35, after 37, or after 40. You certainly can, but it becomes more difficult. You are more likely to have miscarriages once you cross a certain age. And they were more likely to have a healthier child when we are younger. So what do we mean by saying miscarriages? What is the risk there? The reason for miscarriages, as we know, there's most of the miscarriages, or 90% of the miscarriages, early miscarriages, are attributed to genetic abnormalities like Down syndrome, or abnormalities which are not compatible with life, and that happens with the decline in the quality of the egg and decline in fertility of the woman. So the risk of I'm going to just wear my glasses to just see what I've written. The risk of having ongoing pregnancy with a genetically abnormal embryo also increases with age. And these, now what happens when we have a pregnancy which is detected with Down syndrome? So either this pregnancy will end up in termination, or we end up having babies who have got these genetic problems. So This age-related risk is something also that we have to keep in mind. Again, we can get pregnant maybe at a later age as well, but we are having a risk of increased um, genetic abnormalities in the child, increased risk of miscarriages, etc. So this is the graph here you see, which is telling us about Down syndrome related to age in women. And as you see, as we're growing older, there is a significant rise in the incidence or in the chances of you having baby with Down syndrome. So more and more women are delaying childbirth, which we know. And again, I would say that is our choice, and that is an option every woman should have. Which this is because we want to pursue our education, careers, or as I said, you want to do something else. You want to go hiking, you want to go mountain climbing, and that's absolutely fine. That's you can do all these things when you are younger, and you want to do it before you start your family. Um, so what is happening? More and more of us are having, more and more of women are having children after 35 years of age, and there is a almost eightfold increase as compared to the previous generation in women having starting the family later, unfortunately. And what also, there is a little misconception that if we have delayed fertility, or we can probably have IVF later on, but if I want to pursue my career, or if I want to pursue my education. But unfortunately, IVF is not always the answer at a later age. And there is a good reason why. As I explained, we've got increased chances of miscarriages, and there is a decline in the fertility, the more important thing. So here is a study that showed us there's 41.5%. So live birth rate is 41.5% in women younger than 35 years of age. And then, as you see, when we go down, it goes down to 1% live birth chance, significantly lower in women older than 44 years of age. Even 43 and 44 have got only 5% chance of having a live birth with or without IVF. So we make things more and more difficult. So women can come and have IVF, will spend money, and the success rate compared to what she can have when she was younger than 35 to what she's having at 40 years or 40 years plus of age is there is a vast difference in it. So age has an effect on the effect on the outcome of IVF, as I was just mentioning that. So from 41%, it drops down to 4% after 42 years of age. So extent of this fertility decline is not appreciated by most of our fertility specialists, not by most of us, because now we know there is an option, and people we women are not using that option at the right time, and not getting the optimal results of the treatment, of the going through IVF cycle, of the money that they're going to put, all of the emotions and all the efforts that's put later on uh, to go through these procedures. So consequently, what happens is increased rate of infertility with the age, with the quality of the egg. Quality of the egg starts declining after age of 35. There's increased infertility. There's increased rate of miscarriage. There's chances of abnormal pregnancies, and chances of lesser chances. That means lesser chances of having a normal embryo. There is reduced live birth rate, and IVF treatment which originate from all these problems. So there is a very clear cut, enough data, enough research to show there is a decrease in pregnancy rate, decrease in live birth with the age. And IVF cannot address the decline in fertility or a decline in the egg quality with the age. Something very important that we need to keep in mind. So we now know that higher education is associated with delay in the childbirth, because we know. So there is a study, and there was a data that was collected by the CDC, and it's been published to say women at the time of first pregnancy. So there was the first pregnancy, age 30 to 34. There was uh, more and more women were increasing having a first child after the age of 34, 35. So and a lot of women, between 47% of the women had now started having children after 35 years of age. What are the confusions that we have? What are we thinking as women in this era, in this age, in this millennium here? We want to do our education, we want to concentrate on our careers. We have to worry about income, that if I do get pregnant and if I'm going to be taking time off work, how am I going to support? We might have mortgages to pay, we might have other commitments in our life. We might want to do, as I said, other fulfilling activities, going a mountain climbing, which I want to do before starting the family. Or maybe we are at a position that where we don't have a long-term partner and we're not with the right person. We don't have our the prince that charming that we are waiting for. And then if conception happens, and if I do, you might be thinking, if I do get pregnant right now, then again, maternity leave. And how am I going to look after the child in the first year of life, without on the maternity leave, with the limited income and everything? These are very valid points that, and all of us women at this age have to think about these things through. And that could be the reason that you're delaying your starting your family. So, what is egg freezing? Where does this come into picture now? So, in essence, egg freezing is an IVF cycle, but with a pause, with that comma, with that pause that you can put. So, you can go through ovarian stimulation, collect the eggs, and then we just put them in the freezer. And if you do it before 35, when you're more likely to get good quality eggs, you have to freeze lesser number of eggs, and you've got a very good chance of having a live birth when you're ready to use those eggs. So when you're ready, when you want to lift that pause, you want to start, you want to put the play button again, we just store those eggs, fertilize them, and then do the transfer. So this could be very well when you are in your 40s, because that's when you're ready to have a child. But then you're going to have a child. The benefit is you're going to have a child with the quality of the eggs that you were before 35 years of age, which is going to give you that 41.5 up to 50% chance of having a live birth with those frozen eggs. So, what does an ovary look like when we're doing stimulation for you, when we're doing egg collection? So, you see, there is a picture here of an ovary with these follicles. This is an ultrasound picture. Normally, this ovary will have only one follicle, and at the moment, you can see there are quite a few follicles there, because the aim that we have is to collect good number of eggs, as many as we can from one cycle, and freeze them. How is the egg collection done? So this is a picture to tell you just a schematic presentation. So there is an ultrasound probe here that goes into vagina, and this is just the vaginal probe. A needle is attached to it, and through the vaginal wall, this needle goes to the ovary, and this little dot here is the follicle, as you see here. You just suck out the ovarian fluid, the egg comes along with it. This is done under sedation. The process is done under sedation. Roughly takes about 15 to 20 minutes, and you recover in an hour or two, and you're discharged back to go home. So quite a straightforward procedure to do it. And what does it do? So what are you going to achieve by doing egg freezing? So your eggs are suspended in the time or in age at the age when they are frozen. So women who freeze their eggs in the early or mid 30s can effectively reduce the risk that we just spoke about of miscarriages, declining fertility, difficulty in conceiving, and uh, and what else happens when you're facing difficulty in the later life? I mean, I think I've already explained that here. You can just so you could just freeze your eggs. You go and you try naturally whenever you're ready. You might be lucky that you conceive very quickly. You have a child. You get a child, and your first child is born from just natural conception. Um, and then now you're planning to have your second child, but you're well into your 40s. Maybe you want to come back and use these frozen eggs for your second child. And and that time your fertility has declined and you are finding it difficult to conceive and at that time. So that this gives you, even in your 40s, a very good chance of having a live birth, a successful, healthy, normal child. So this by this doing this, you can actually, if you think about a 40s woman having a success rate of anything between 25 to 20%, you are having a success rate of a much younger woman, because it depends on the age of the egg that it's frozen. What are the risks of egg freezing? So risk is earlier. So again, all this revolution has happened after we had this new technique of freezing the eggs, which is called vitrification, which is fast freezing. Ages ago, we used to do um, slow freezing, which had the risk of forming crystal formation, and that could damage the meiotic spindle or damage the egg, or interfere with the quality of the eggs. But these are now overcome by this new wonderful technique of vitrification, which is very quick, fast freezing of the eggs. The other risks are associated are the same risk as ovarian hyperstimulation, that is when you can have it during IVF as well. But again, that now we've got a very safe protocol that we use, which is the short protocol, or antagonist protocol, for all the women who are doing egg freezing. And we use a trigger, which is agonist trigger, which minimizes your chances of hyperstimulation to less than 1%. So practically nil or no chances of hyperstimulation. And other small risks are infections, but you're given antibiotics to cover that, the small risk, or any injury to organ. But again, they're far and few, one in thousands, but something that it's a very, very low risk of any of those. So what you should be doing now after I've told you all this information? The aim is that first, an aim is that this information should be out there. Every day I get women who coming for treatment, and they say, I wish somebody had told me that I had this option at the right time, where all the money that I'm putting in today, I would have put in probably half the amount and got better results. So my aim is, first is have the information, be aware that you've got this choice, you've got this option of coming and freezing your eggs, and have that peace of mind that you can take your time, do whatever you want in your life, and you're still fine. It doesn't give you 100% guarantee. There is nothing called 100% guarantee in life, but it does give you a very fair, good chance of having your own biological children. So what you should be doing next, you should get your fertility status assessed. So what that means is you should get your ovarian reserve assessed. Ovarian reserves depend on the age, as we've discussed, all the factors, what age does. And we do a blood test, which is anti-Mullerian hormone, that tells us the reserve of the ovary, what's there in your little bank that you got, what's left in it, and antral follicle count, which is done by doing a vaginal scan. Look at your ovaries, we count the number of follicles, we put the two together, which is the anti-Malarian hormone and the follicles and follicle count, and that gives us an estimate of your ovarian reserve. Then we can have a consultation to discuss your results and give you an idea of where you sit in terms of how much time are you okay, and you don't have to rush into doing it right now, even though I do say that earlier you do it, the better it is, and the better the quality of the eggs will be. And again, there is a study here which tells us less than 35 years of age, 50% live birth, not love, that's a misspell, live birth rate, and 60 to 85% chances with 10 to 15 eggs. So you have to freeze much lesser number of oocytes or eggs if you're freezing less than 35. So around 15 eggs will give you 60 to 85% chance of having a live birth when you're ready to use it. And when it comes to more than 36 years of age, around 15 eggs will give you 23%. So if we have to take it to 60%, then we need to double those number of eggs to make it more likely, around 30 eggs to freeze, to give you a good chance or a reasonable chance of having live birth. This is a study, very, very interesting and very important study. What do women say? Women who've had oocyte freezing, what do they have to say about it? So they say none of them regretted that they had this procedure. So that is a very big thing to tell you that it's a very doable procedure. It's a very easy procedure. I wouldn't say easy, but it's a very something that can be done very easily. 95% of the women said they would do it again. They would do it again if they've done one cycle, they couldn't get the right number of eggs, or they've got 10 eggs, they're happy to do again to increase that number, to give them a little bit more insurance and to give them a little bit more peace of mind. They would be happy to do it again. 75% said, very important point again, I would do it, would have done it or would do it at a younger age. So if I have to tell someone I've done egg freezing, if I want to tell someone, I would say the younger you are, the better you are. Do it at a younger age. Do it now. Go get going. Find out your ovarian reserve, and it's time to freeze. Freeze your eggs. According to me, what I think, this information is not out there, not enough out there. It should be given to even as little as young as when you're moving out of your school, when you're starting your universities. There should be fertility education to all women available so that they can make the decision at the right time to get the best outcome of their fertility. Thank you so much. Thank you for listening. I think I've been talking too much. Now it's your turn to ask me questions.
Excellent. Thank you so much for this presentation, but mostly for that advice, for all those details, because this is, as you said, this is something that should be more out there, so all women do know what to do, and so huge thanks for that. And yes, it is time for our patients' questions, and there are some questions ready, so let's get to this. And well, are you ready for the questions as well?
Yes, I'm ready. Yes.
Perfect. Happy to hear that. And the question is quite long, okay, but we can manage, right?
Yes, I've got my glasses, so I'll be fine.
Perfect. I will read allowed, of course, but let's go. Let's take a look. Thank you for this webinar and all the information that you give us. I'm in a wheelchair. I have Sirion Jamil, sorry, D9, D12 that affect my mobility and give me nerve pains. It's autoimmune disease and I take treatment for nerve pains. Lyrica and Lamalin. I have the Hashimoto's disease and take levothyrox 50 and 32. I don't have any periods for several years. I just have some blood but once a year. But I had an ultrasound. I have some follicles, so I can and should I. So can I and should I need to freeze some eggs? And how? When I don't know if I can do it when I have periods because they are difficult to predict. They are rare and once or twice a year. Can you explain the egg freezing about the egg donation? Can I have the egg from my sister or can we use an egg from anonymous donor and give it to my and I'm in a couple, so what options do we have? What are my chances to have a baby with autoimmune disease? What can I do? What is the nuclear and spindle transfer? Is it an option for me? Lots of questions, but I believe we can make it one step at a time, right?
Yes. If I would start with saying, where do I start with? I would say, let me just go down there. So, one question, what I said, can you have egg freezing? Should you think of doing egg freezing? I would say yes. What I want to know, so syringomelia, I just want to know it's a mutation, did you say? Can I go back up?
You can scroll it
Scroll
down.
up, right?
Mhm.
If it is a mutation that can be carried um, onto the offsprings, then maybe if even if you are doing egg freezing and at the time when you will be doing fertilization of the eggs, then we will need to do PGD, that is the testing of the embryos. And if it is just a de novo and it is something that's just affecting you physically at the moment, yes, you can do egg freezing even if you are not having your periods. Um, and we can assess your ovarian reserve. First, we need to assess your ovarian reserve. As I said, do a scan to see. And you said if you had a scan and there are some follicles, we can regulate your period. We can bring on bleed and stimulate your ovaries if there are eggs there and if there are some follicles there, and we can freeze them. And if you said that you are in a relationship,
Yes, yes.
yeah,
It was right here. Yes.
if you are in a relationship, I also want to mention that embryo freezing is much stronger and gives us a much stronger chance later on when we are ready to use, because egg is a single cell and obviously it's more vulnerable to damage as compared to embryo, which is hundreds of cells and they're frozen. It gives you better chances when they're they can withstand these processes of thawing and freezing much more easily as compared to the egg. So when it's time, so when my suggestion would be, if you are in a stable long-term relationship, you could freeze embryos, or you could freeze both. You can freeze eggs and embryos, and see which should be which you can use in future. And chances of having a baby with autoimmune disease, you can have baby with autoimmune disease. It will be obviously the consultant that you're under. We have to see what medication you're using, if they are in if they've got any, can you use this in pregnancy and can you have a transfer by using pregnancy, or they can use some alternative medication. But yes, we do have patients with autoimmune disease and they do have successful pregnancy. um, if we are nuclear and spindle transfer, if we are talking about if we're talking about the any mitochondrial transfer, these are still in experimental stages. Yes, we have done and there are far and few that are doing. Some centers are doing, but not yet established that these can give us, there's not enough data out there for me to tell you that something can be done like this and something like this will be successful.
Okay, perfect. Thank you so much for, well, that question as well as your advice. Of course, lots of those details, but as you can
Sorry,
see,
I think there was another question. Can you use donor eggs, right?
yes, there was exactly.
Sorry, yes, you can use donor eggs as well. You can, if you were saying that if your sister can donate it for you, that can be done. That is as a known donor, or you can have anonymous egg donation as well. That is an option.
hmm Okay, perfect. Thank you so much. Actually, sorry, I will just add it because it's something additional from the very same patient. Okay, so my TSH is stable, so my FSH is about 90.8, and my LH is about 49, and my beta strato is 23. Something that you could add to this as well.
Um, so, unfortunately, these levels that you've said, an FSH of 90.8, is not very reassuring because this is telling me that your reserve is very, very low, and you missing periods or not having a bleed or having an occasional bleed is because it's almost a menopausal level of FSH that you've got. Not almost, it is actually menopausal. So these results of low estrogen, high LH, and high FSH is actually saying that maybe you having a cycle yourself of egg freezing might not be an option now. And maybe looking into egg donation is more realistic for you.
All right, perfect. Thank you so much once again for that advice as well. Okay, and well, let me just have a look. We do have more questions, so let me go to the next one right here. Sorry, I just need a second to publish that. Oh, here it is. Okay, just thinking about my nieces who are career minded. They aren't in a relationship or thinking about settling down. They have spoken about freezing their eggs. At what age would you recommend they freeze their eggs?
Um, I okay, so I've just said that earlier it is the better it is, but I would how old it will be useful to know how old they are at the moment. I still don't think that women should start thinking in their early 20s because that is still very young age, and we don't they might just conceive naturally, and if they are planning that, but once they hit 30, I think 30 when it comes to that. And if they at that time, if they're still not, the late teens, early 20s. Okay. Late teens, early 20s, I would think they should, as I said, 30 is probably a good time, or very late 20s, early 30s is a good time to do egg freezing, if they are not at that time planning to start their families.
Okay, excellent. Thank you so much for
But
that.
it will be always good, for them to be aware of it, that there is an option, and then they should get their fertility status checked, which is very easy, getting a scan and an AMH. Maybe, once they are 26, 27, 28, just get that done, which gives them the idea that, what's a good time? Are they okay for the next 2, 3 years? Should they wait till 30 and then fine, you know, do the egg freezing at that time? I think every young girl at the age of 30 should get the birthday present as an egg freezing from their parents.
Okay, perfect. Yes, maybe that would be actually a good idea, to be honest. Yes, so thank you so much again for that question. Definitely important, and definitely we should, well, educate. Yes, those younger women. They are definitely not ready, but and they should know, they should learn. Thank you so much for
Absolutely.
that. And next question is up right here. I am in the UK. I'm 46. If I use an egg donor and have ICSI, would I have a hospital birth or could I have home birth?
Um, okay, so that question is using egg donor or having ICSI is no indication for you to have a hospital birth. Okay, so you anybody can have an egg donation and fertilize it with ICSI, and the reason would, if you have to have a hospital birth or if you will be indicated to have a hospital birth, is because if there is any medical conditions associated. And how is your pregnancy going? Is it going all, as we expect it to go? If the baby is growing well, if if I tell you today that you have a home birth, but then on scans, if it is small for date or if it is not going well or you develop any complications, because when we cross after a certain age, we are likely to get some complications during pregnancy as well, so you would need proper monitoring and that. So that would be the reason that you will be more indicated to have a hospital birth rather than anything to do with egg donation and ICSI.
Okay, perfect. Thank you so much once again for that answer. Okay, next question is up right here. So, how many eggs do you recommend? I am 37 and I recently froze 10 eggs. I am now reading that a lot of the eggs don't make it past unfreezing, that I should freeze embryos with donor sperm instead because they are more robust and can give more information about egg quality since there is no way to know how good my egg quality is. Should I try to freeze more eggs or freeze embryos?
um so Kelly, you said you're 37, right? um
Yes.
10 eggs, I would think that yes, you should have more eggs frozen. We would have been fine if we were less than 35, if you had 10 eggs. But above that age, as I just mentioned in my presentation as well, we should aim to get at least 20 eggs frozen. Um, and yes, embryos are more stronger, as explained, that they have got a lot more cell number. So while thawing, if we lose a couple of cells, then they can still 100% give a good chance of having a normal baby and a live birth. However, egg is a single cell. It is the largest single cell of body, but it is a single cell, so more prone to, when the thawing process and everything, it might not survive. So normally, when I have patients who come to me, a woman who are single and are doing egg freezing, I always recommend them that maybe have a couple of cycles of freezing your eggs and do at least one cycle to create embryos with donor sperm and freeze that. In future, that gives you an option that if you are with the right person and you are in a relationship, and then you've got eggs that you can use. If you might not need them, as I said, you might fall pregnant naturally and you might need that for second child. And if you do not um, find the right person, or you are single and you do want to still have that option or want to consider having a family, then you can just simply take a frozen embryo and do a transfer, which will give you a very good chance of having a successful pregnancy.
Perfect. Thank you once again for that advice. And actually, the next question is quite similar. But if you could take a look, because there is a next part to the question. So here it is. So I was told by a fertility specialist it's a waste of time to freeze eggs and the outcome is not very good. It's better to freeze an embryo. Is it better to freeze an embryo then? And also, is frozen egg as good as fresh one?
So okay, I one is again age. It will be useful to know how old you are, and um, because maybe after a certain age, maybe having an embryo will tell us a little bit more and give us more surety than freezing eggs. However, freezing eggs is not a waste of time. freezing eggs, if you're doing it the right time, is
It's
you're
the same.
fertile. You're
Patience is 40. Okay, just wanted to add.
40-year-old, and if you have a reasonable ovarian reserve, you still can freeze your eggs. But yes, you would need a lot more in number of eggs frozen, maybe 35 eggs frozen, to actually get that reasonable chance of having a live birth later on. So, and if you, as I just said in previous one, I would always say do a couple of cycles of egg freezing and then do a embryo freezing as well, so you've got an option both ways in future, to either use your eggs or straight away go and use your embryos. And there was another, oh, frozen eggs as good as fresh ones. There has been studies to say that these days, with the technique of vitrification, and with excellent labs like, I would say, ourselves, and I'm sure there are a lot of labs now having all the latest facilities, then egg frozen eggs can or do give. There is a study which actually shows, I don't know if I have it right now, but it's compared the fertilization rate, um, clinical pregnancy rate, and the live birth rate, which was very, very comparable in between the frozen eggs and the fresh ones. So answer is yes, frozen eggs is almost as good as fresh ones.
Okay, thank you so much again for clarifying this to us. And there is like a question, if you could clarify this as well. So to freeze an embryo, you need to make it naturally, or it can be done in vitro?
So it is done in vitro. I didn't understand why. What do you mean by naturally? So basically, when we are doing the ovarian stimulation, we collect the eggs. Instead of freezing them as eggs, we will then, if you have a partner, it will be fertilized with your partner's sperm. And if you do not have, you single, you can select a donor sperm, and then the donor frozen sperm will be used to fertilize these eggs. Embryos created, or fertilization happens, and the embryologist observe these embryos in the lab up to day 5 or day 6, and then these embryos now, which have got hundreds of cells, are frozen at the stage of blastocyst for you.
Excellent. Thank you again so much for clarifying this to us as well, just to make sure. And now, next question is here. I am considering a frozen donor egg, as that is available with our traveling abroad. What
Yeah.
are the yeah, sorry. What are the statistic of a live birth compared with a fresh donor?
So, Una, as I said, there has been studies that has shown that use of a fresh egg as a donor egg, or using of frozen eggs as a donor eggs, have got statistically almost similar results in once they are thawed. The only risk that we have with frozen egg is that they are frozen, they need to be thawed. And if we are likely to lose some eggs in this process. But once they are thawed and they are fertilized, or they are injected with the sperm, the chances of them getting fertilized, creating an embryo, them um, implanting, and them giving a live birth is very comparable to the fresh eggs. So the only risk factor in fresh versus frozen is that we might lose some eggs when we are thawing them.
Excellent. Thank you so much once again for answering this question. And there's actually a follow up. Sorry, I missed that before. It's about the patient. You have advised that possibly egg donation is a better option. Yes, this is a previous patient, and so she has added, my results blood said that I'm in menopause, but my ultrasound said that I have follicles. Anything you could add?
Uh, yes, Maureen, I would say egg donation still, because with that reserve or with the FSH level that we've got, and once you are hitting menopause, even if there are little follicles there, or if there is any leftover follicles there, they're likely to be not give us any good eggs there. So even if we do stimulate, we might not be able to stimulate the ovary with such high FSH when it is during menopause, and if even if there is a follicle that grows, we might not get an egg which is worth freezing or will give us any results later on. So that will be, going through unnecessary um, uh, all the things that are involved without any results. So my advice, strong advice, would be start looking into egg donation.
Okay, thank you so much once again for clarifying this once once more. And there are like few questions left, so we will be slowly finishing. But I just want to make sure that you have asked all of your questions. If not, do it now, of course. And the question is right here. So, how many embryos, blastocysts, would you expect in general from 10 eggs frozen at early 30s?
Very good question. It does depend, and it does depend on a lot of factors, external factors, as well as the age, which you've already said it's early 30s. But because lab conditions and the quality control and everything in the lab matters a lot as well. But in general, from 10 eggs, I would expect uh, 4 to 5 blastocysts, a good blastocyst in early 30s.
Okay, perfect. Thank you once again. And let's. Okay. There's another question from Maureen. If you could take a look. If I'm in premenopause, can I have any solution to my egg freezing with my genetics? You have mentioned this before, but if you could just clarify.
Um, so the only thing that I can add to this, Maureen, is that there are new techniques, the latest developments that are there, like ovarian rejuvenation, that is now some few people are doing and some clinics are doing. We're still not doing it in UK at the moment, but some clinics in Greece are doing, where they take your plasma rich protein and they are injected in the ovaries, and some women, and there is again not enough literature, there's not enough research, these are all still experimental, in experimental stages. Those that could be something, then maybe you can find out, and something that maybe you can try, that if that gives any chances of your ovaries starting to produce any follicles, and then eventually we can think about doing a stimulation and freezing those eggs.
Okay, excellent. Thank you so much once again for this. And right, the next one, it's not actually a question. However, I think well, I just want you to see it. Okay, I agree that this information should be available to schools and students. Young people are not educated enough about egg quality declining and believe that they can have children at any age. I was one of them. I'm now 46 and have no option but to use an egg donor. Things really need to change. So thank you for a great presentation. And we couldn't agree more.
Thank you so much. Thank you for acknowledging. And then, as you know, um, we need to be the ambassadors, we need to be there, we need to be out there telling as many women, as many young women, where it is your workplace, where it is your family, your friends, that there is an option, and please be aware and use it. So yes, I think we need, I if I'm given an opportunity, I'm happy to go to universities, to school, to give a talk and make all these young women aware of this.
Excellent. Thank you so much. As I mentioned, this is something that we definitely need to be thinking about, and of course, as you mentioned, about our families and friends, etc. as well. We can do it. So, huge thanks. It seems that we do not have any more questions. So already, I would like to thank you, Dr. Malini, for joining us. It's been wonderful to. Okay, sorry. In the meantime, there's one more question. Okay, so let's go ahead with it right now. Okay?
Yep.
Perfect. Okay. A bit unrelated question though. I want to use my husband's sperm, which was slow frozen from 12 years ago. Our problem is this sample, the best quality out of our other samples, won't be accepted by the Ministry of Health in many countries because we don't have an infectious disease test within 2-3 months of the sample given, because I would have been the recipient. The closest tests were done 6-7 months beforehand, which they won't accept. We don't want a fresh sample as he's older now and the possible risk of children being born with autism, dwarfism, etc. Do you know whether an infectious diseases test can be done on frozen sperm?
Infectious diseases test cannot be done on frozen sperm. So infectious disease test is done. Is it your, you said that it's your husband's sperm.
Yes, this is cousin sperm.
So because infectious disease test is done from the man producing the sperm to make sure they are not carrying any of the infectious disease like hepatitis or HIV, Hep B, Hep C, like that, so that the sperm can be frozen in the lab. So people who carry infectious diseases, sperm has to be frozen in separate containers so that there is no chance of cross contamination or cross infection. And that is the reason of infectious screening. And the when if a sperm is used as a donor sperm, then we need to repeat the screening again after a quarantine period. So I don't understand that you've got slow frozen sperm, which you had frozen earlier, and their Ministry of Health. Where are you based?
If you could let us know as well, just to make sure so we can answer you more in detail, right? Many countries. Okay. Patient has added now we will use a surrogate,
Ah,
but
it's
want to
uh,
do a cycle in Ukraine. Okay. So in Ukraine, it's also not accepted.
yeah, because if you're using surrogate, then this becomes a donor sperm, and and uh, and that's where the difficulty is, because if you want to use any sperm as a donor sperm, then it has to have that post quarantine blood test as well. And I think that's where you're having problem. But we cannot do the infectious screen on the frozen sperm.
Mm-hmm. Okay. Okay, sorry. I will show you there's a follow-up as well, okay? We've had many regular blood tests which always were negative but still won't accept regular blood test.
Yeah, see, that is the legislation. So that is wherever you're having the treatment, they, like, we have to follow all our HFA guidance that is available to us, and we have to follow those rules as per the country. So it's unfortunate that uh, you know, and I think then your option is to use fresh sperm then, and that will be the best option that you'll have. And yes, there are some studies related to increased risk of autism and everything with the advances in age of the male partner, but still, as we say, it's only probably after 50 that the more of these studies are 50 years of age. So, and still a very small chance of it. So if there is no other option, I would say fresh sperm is still what is the option that we've got here.
There are some other options. I mean, additional information. We have another sample, all FDA approved from 3 years ago, but not as good quality as 12 years ago, of course.
um, even if the sample is not good, as long as there is some sperm, I'm sure with the techniques that we've got now in the lab, ICSI can be done. I don't know what the parameters of the sample are, but if there are motile sperm in the sample, which is all FDA approved, I think that will be then again your choice that you use that, and ICSI in good hands can give a very good result, even with yeah, yes, they are. So there are motile sperms. So I would think yes, you can use that, and an ICSI with a good ICSI practitioner in a good lab should give you good results.
All right, perfect. Thank you so much for that question as well, and as well as your assistance with that. And it does seem it's our last question for tonight. So huge thank you for your time. It is a Friday evening, so happy that you still were able to join us. And as you can see, there are plenty of things right here. And I just want you to see that that was very helpful. So
Thank you.
just checking, but all of those are definitely thank you. So again, thank you, Dr. Malini. It has been a pleasure to have you here, and I hope we will have you back, of course. And thanks to all of you to again joining us over and over again and just asking your questions. We do believe it is very useful for you, and we definitely want to bring more topics to you, and we definitely want to help as much as possible. So thank you. And I just want to remind everyone that this has been recorded, so you will still have a chance to simply watch it within the next few days. It will be available on our website, myivfanswers.com. And I can only encourage you to share it with anyone from your family, any young women that might be quite helpful for them to find out, to learn. We definitely want to spread those this information, that there are possibilities. So huge thanks, Dr. Malini. Have a lovely weekend,
Thank
and all of you,
you. Have a lovely weekend,
thank you
and
as well.
yes, spread the word. Remember that. Spread the word.
Exactly. That's the truth. And also, I will be back here on Monday at 6 p.m. UK time and at 8 p.m. UK time. So get some rest during the weekend, everyone. And I hope to see you back here on Monday. Thank you. Bye.
Thank you. Bye bye. Bye.